Let's talk about something other than statistics. Now, I'm sure students in statistics classes, perhaps you've appreciated the videos I've done about statistics recently. Maybe not, who knows? But I'm sure if you're not in a statistics class, maybe you're thinking, hey, are we ever going to talk about other things? Let's talk about other things. So right now, I would like to talk about uterine health. Now, you might be thinking, hey, don't people usually call that women's health? Well, some women don't have a uterus. I'm some women. I've had a hysterectomy. I don't have a uterus. This is still relevant to me because when I had one, I sure paid attention to a lot of these topics. Some people have a uterus who are not a woman. So we are going to have that appropriate level of specificity. What are we talking about? We're talking about the uterus. So let's call it uterine health. Now, whenever I talk about anything related to the uterus, one thing that people often want to ask about, why does mine make me hurt so much? Do you have that question? Let's talk about pain. Let's talk about pain in the uterus. Now, here is where it's very important for me to remind you, I am a doctor, but not a medical doctor. If you have any concerns where you want a diagnosis, you want testing, you want an answer as to what is going on in your body, and you deserve that answer, you need to go to a medical professional to get that answer. If you ask me for a diagnosis, as much as I want to help you, I won't be able to help you in that way. I am a researcher. I am a professor who teaches human development. I teach statistics, research methods. I know how to look things up, but I don't have the applied practical training and skills to do things like diagnosis. So please, I know it's hard to get to a doctor, especially if you're in the United States, but please go to a doctor if you have concerns. Now, where shall we begin? Some of the most urgent questions that sometimes will come up when talking about the uterus are things like, do I have to have menstrual cramps? Or what are menstrual cramps? Like, what exactly is happening? And we can talk about both of those things. We can incorporate other things into those topics. So let's start with some basic stuff. All right. So when we're talking about menstruation, where menstrual cramps would happen, what is that? Because a lot of people are like, I know what it is. But then when I teach classes, I find that a lot of students are like, oh, actually, I don't know. There's a lot that I don't know. So let's start with one thing. Menstruation, the period, the bleeding, right? Menstruation happens within the menstrual cycle, but the menstrual cycle is this large thing that the actual period, the menses, that's another fancy word. All right. The period, it's just part of this larger cycle. And some people have been exposed to this. Other people, they're like, oh, nobody ever taught me that. It would have been nice to know that, especially if, you've got a uterus. So let's talk about the menstrual cycle. So the menstrual cycle, if you want to be nice and broad, it's the span of time from the beginning, the first day of one menstrual period, to the first day of the next menstrual period. Of course, that would be if no pregnancy happens, all right? And so there are various things that happen during this cycle. It's not just the period. Now, hopefully, if I remember to do things correctly during editing, which is not a guarantee, folks, I ain't no influencer. I don't get paid for this. I'm doing this by myself in my own free time. But if I remember to do things correctly in editing, a little image should show up right about here, showing the different parts of the menstrual cycle, which in the image, it actually says the period cycle, but it's a cycle. It's a full cycle of different events where the period, it's just one of them. All right. So when the period starts, that's called the menstrual phase. What's going on during that time? You're having a period. And depending on the person, you may be miserable or you may be thinking, oh, this is just a hassle. There's a lot of diversity. There's a lot of individual differences in terms of what it's like. We'll talk more about that. And so the average length of the menstrual phase, the period, is 3 to 7 days. Some people get lucky enough where it's like only 2 days. And whenever they tell people that, they're like, don't be spreading that around. People are going to think that that's normal. They're going to expect that. And that's, yeah. And some people go longer than 7 days, sometimes because of just genetic variability, but other times because of specific medical conditions. And so the uterus is contracting to expel the lining that didn't get used for a pregnancy, basically. And during this time, what's it like? Depends on the person, but things that you can see during the menstrual phase are cramps, back pain, bloating, feeling puffy, tiredness, fatigue, and tender breasts. Now, other people will have other symptoms. These are just some of the most common ones. Now, then you move into the follicular phase, name for the follicles. What are follicles? I find a lot of students in my human development college classes, they're like, nobody told me that term before. Those are things that might become ova, might become an ovum, an egg. All right. So this usually lasts around 11 to 27 days. And this is when estrogen, that's a hormone, if you don't know about that. And also sometimes it's pronounced with an E, starting with an E in the US, and it's usually pronounced estrogen, I see in the US, but in other countries, like when I see British content, they tend to say estrogen, and sometimes I see it spelled with an OE in the beginning. So we're talking about the same thing if you've seen it or heard it that other way. And so estrogen rises as an egg. The levels go up as this swollen follicle that could become an ovum prepares to be released. Now, it's actually not just one. There's actually a lot of follicles that swell. You get bumpy ovaries. I had one student thought it was funny when I talked about bumpy ovaries. And essentially, one will win. One will be the biggest one that gets released as the ovum. All right. But basically, that's what's happening during the follicular I can say it, I really can. The follicular phase, you're getting bumpy ovaries, if you have ovaries. They are swelling and getting ready for ovulation. So what's ovulation? We get to the ovulation phase. Ovulation phase, now this is short. This is only 24 hours. Now, if you think that means, that's only 24 hours where a pregnancy can occur, covered in a different video, but sperm can last up to 6 days. So don't be thinking that means you only have a 24-hour window. No. All right, but ovulation. That is when the largest follicle gets released as an ovum, an egg that could be fertilized, that could lead to a pregnancy. All right. And so which follicle gets released? Whichever one's biggest. And sometimes people think that it alternates between right and left ovary, like 50-50. No, it's just kind of random. It works out to 50-50 statistically. But just, whichever one's bigger. When there is a surge of something called luteinizing hormone, you have this big surge, and it basically says, release the biggest one, release an ovum. And usually it's just one. There's our exceptions, but usually it's just one. It gets released, and if there is sperm around, they could fertilize that and make a zygote, which is a new individual, a new pregnancy, fertilization. And so, do you feel ovulation? There's a lot of debate on the degree to which you may actually feel ovulation, but one thing that you can see is a rise in basal body temperature. Now, this is very small. People who track this, they will get a special thermometer that goes like down to the decimal to see this little rise. Now, the rise, it doesn't mean like, you're ovulating right now, but it happens, around the time of ovulation. And discharge. People don't like to talk about the fact that stuff comes out of there. Folks, it's natural. It's normal. It's human, at least for roughly 50% of humanity. That's what happens. All right. It's normal. It's healthy. The cervical mucus, the stuff that is around the cervix, which is the entryway to the uterus from the vagina, the vaginal canal. All right, it changes in consistency, and it becomes more like egg whites. And then sometimes people think, if you put egg whites up there, will it affect your fertility? And yeah, lots of debate about that. All right. But you do see a change. And so the stuff that comes out may look different during that time and more like egg whites. But a lot of people, they don't know if they're ovulating without tracking ovulation or getting an ultrasound or something like that. And then we move into the last phase of the menstrual cycle, the luteal phase. And this is 12 to 14 days on average. And this is where, if a pregnancy is going to happen, it's preparing for that pregnancy. Doesn't always lead to pregnancy, doesn't always lead to a viable pregnancy. But the body goes through changes that are meant to start a pregnancy if that zygote has been formed. And so what do you get during the luteal phase? There's individual differences, but you can see mood swings, headaches. Headaches from estrogen withdrawal is a big reason for those headaches. Breast pain and food cravings. Now, some people are like, how do I eliminate the food cravings? I'm not supposed to want food. And we forget that humans need food to eat. But that's an issue for another day. So that's your basic menstrual cycle or period cycle. So the menstrual period, if there is not a pregnancy or if implantation is not successful in that pregnancy, if you don't know what that is, I have other videos about pregnancy on my channel. So if there is not a pregnancy there's no pregnancy or not one to continue, all right, then you get another period, all right? You get another menstrual phase beginning, another cycle beginning. And so why is that menstrual period sometimes painful? Why? What are the reasons? Now, this is actually a more complicated question to ask than it may seem. For one thing, if you just do a Google search, and I started here, just do a Google search like, hey, why, what causes menstrual cramps, I think, or why, some simple question like that. I wish I could remember the exact question I asked. But anyway, typically when I do a search like that, the first result that I get, and hopefully I remember to put the sticker up here, is from the Mayo Clinic, and that's a respected medical site. And when it talks about menstrual cramps, it kind of goes the clinical route. So it says menstrual cramps or dysmenorrhea. That sounds scary. That sounds like a diagnosis, but it's not. I mean, you can have severe issues, but this can just happen from having a uterus. All right. So menstrual cramps or dysmenorrhea are throbbing or cramping pains in the lower abdomen. I know for some of us, just hearing those words, we're like, oh, sympathy pains. All right. Many women or people with a uterus have menstrual cramps just before and during their menstrual periods. Okay, nice and vague. For some women or people with a uterus, the discomfort is merely annoying. Lucky. For others, menstrual cramps can be severe enough to interfere with everyday activities for a few days every month. And this is where we do see a lot of diversity. Some people regularly miss school or work because of the intensity. Before I was allowed to have a hysterectomy because of my issues, and we'll get to why I had those issues in a bit. It is going to be relevant to some of the things that we are talking about. I was having difficulty standing up while teaching. I was having severe problems. I had to carefully document what exactly was happening to be taken seriously. Like, oh yeah, this is not just the regular stuff that can happen. And we do need more research on what is regular, what is normal, and how we can help people even who are having the normal, regular, expected, typical levels of dysmenorrhea, cramping. Nobody likes cramping. Why, just because it's normal doesn't mean we want to go through it. All right. So conditions such as, we'll talk about these later, endometriosis or uterine fibroids can cause menstrual cramps. So it can just be from having a uterus, or you might have another condition. And we'll get into some terminology differentiating those different ways of having cramping. And treating the cause is key to reducing the pain. Menstrual cramps that aren't caused by another condition, so a lot of them, tend to lessen with age. Not a guarantee, but they tend to, and often improve after giving birth. Well, giving birth's a pretty big life event. So we really can't recommend that. I mean, I would hope that nobody's going to say, oh, I just give birth and it'll help with your cramps. Because first of all, it's not a guarantee, and giving birth's a big deal. But mine did not improve after giving birth. But I also had an underlying medical condition that we'll talk about in a bit. Now, another question before we get into more about dysmenorrhea, another question that I often get is like, well, what if I have cramps, but I'm not on my period? Should I be getting menstrual cramps when I'm not on my period? I say, well, if it's not around the time of your period, that probably wouldn't be menstrual cramps. And always I say, and you need to talk to a doctor if you have these concerns. So same is true for you. But there are reasons that you could experience something that feels like menstrual cramping or very similar to menstrual cramping, but it's not from the uterus contracting from menstruation. So you could also have cramping from early pregnancy. Implantation and the stretching of the uterus can lead to that. So maybe a pregnancy test or a visit to the doctor is in order, or both. And then also, speaking of pregnancy, ectopic pregnancy, very dangerous. You want to know if this is going on. Ectopic pregnancy can also lead to cramping. If you don't know what ectopic pregnancy is, that's a pregnancy where that developing individual, instead of implanting in the uterus, where it's the ideal place to implant, it implants somewhere else. And it can be in a place that's just not set up for pregnancy and very dangerous to the person who's pregnant. Now, you can also have cramping from pelvic inflammatory disease, one of the many reasons to see a doctor if you have any kind of concerns with cramping. Also, ovarian cysts, which can be very risky. And, depending on the person, depending on the case, and then also endometriosis, which is going to come up frequently during this discussion. All right, so you can also have really bad gas that for some people will feel similar to menstrual cramping. I mean, all these things are kind of close together. Digestive issues can sometimes be mistaken for menstrual cramping. And then also I've seen at least one peer-reviewed scholarly article recently where they were looking at the role of abdominal muscles, not uterine muscles, but other abdominal muscles contributing to the cramping experience. So, so it's not always from menstruation, but we're going to be focusing on cramps that are from menstruation. Now, when you have cramping, there are two types that one might have, and there's primary and secondary. And most people without, medical diagnosis have no idea what kind that they're having. But primary dysmenorrhea or menstrual cramping is not caused by any underlying medical condition. It's just caused from having a period. And it is most severe, typically, within the first 12 hours of menstruation. Like some people will say, that first day is really bad, or right when it begins is really bad. And that's true for not all, but many people. And then with primary dysmenorrhea, typically the pain decreases with age. Now, secondary dysmenorrhea is caused by an underlying reproductive system disorder or disorders. Many people who have these disorders don't know that they have these disorders, and they don't know that their experience of menstrual cramping is unusual because many of us are never told what is normal. We're not supposed to talk about this. It's a taboo topic. Very often it's not until you're talking to a really good friend or a family member and you'll say something like, oh, those days where you just can't see. And they're like, what do you mean you can't see? Well, where it just, you can't use your eyes because the pain is too intense. And people look at you like, what are you talking about? And, you say, in those days where, you're wearing 2 tampons and a pad and you still bleed through. They're like, no, that's never happened to me. What are you talking about? And so then you go to a doctor, and then if your experiences are anything like mine, sometimes the doctors will be like, oh, yeah, periods are rough. That they're supposed to be that way. Okay. But I'm pretty sure mine are not normal or not typical. Oh, that happens from estrogen withdrawal. Okay, thanks. Good to know. But can we do anything so that I don't pass out in class? Things like that. But if someone actually does get diagnosed with one of these conditions, which we'll talk about, then they say, oh, you're having secondary dysmenorrhea. All right. This is longer lasting and more persistent pain. Again, a lot of us don't know how much is normal pain. And when someone says, oh, how much pain are you in? Oh, the usual amount. Well, the usual amount is none. What? That actually happened with my child. They were at the orthopedist. They have scoliosis. Luck of DNA. I gave it to them. But they, they're at the orthopedist, and the orthopedist says, so what's your pain like today? And they did the thing. They're like, well, not too bad, just the usual amount. And I looked at him like, oh, I know, you were not supposed to have any, but I always have some. So some of us always have some, and that also is true. For sometimes with dysmenorrhea, it's hard to know, well, like, what's baseline? What's normal? Am I always in a bad state? It's hard to know sometimes. So you got to be a little annoying sometimes and be like, please listen to me. I'm trying to explain what's going on. And with secondary dysmenorrhea, typically the pain increases with age. All right. So what if you got both? So let's talk about, like, if you just have primary dysmenorrhea, you just got cramps because you're having a period. What makes that happen? Why does it have to be painful? And we're not going to get into religious explanations. I know there are some religious explanations that, it's punishment, but biologically, what's the explanation? If you want to blame somebody, if you want to have a villain, if you want to have a culprit in the story, it's prostaglandins. Prostaglandins are at fault. So these prostaglandins, when you have your period, they form as a response to a reduction in progesterone. So progesterone is something that's present during that luteal phase, during the menstrual cycle. And so in the follicular phase, estrogen was really high. In the luteal phase, progesterone is really high. And I'm oversimplifying. All right. But then you get this drop in progesterone, and you have a rise in prostaglandins. So prostaglandins, they have a purpose. They trigger the uterine muscles to contract, which is important. That's how you're going to flush out the stuff that's not needed for a pregnancy and get ready for the next potential opportunity for pregnancy. I mean, that's what the system is set up. That's its function. And so those muscles begin to contract, and they contract because they're pushing stuff out. Well, the uterine muscles, in response to these prostaglandins, they pinch off blood vessels, and so they're restricting blood flow. And these blood vessels supply the uterus with oxygen. So you're getting less oxygen to the uterus. The lack of oxygen is what causes the pain. The lack of oxygen is painful and leads to cramping. So it's got a function, but it hurts. Prostaglandins are also responsible for digestive issues that sometimes come about during the period. If you know, you know. All right, sometimes things change in consistency and urgency. That's largely due to prostaglandins. All right, so if we want to hate something, we can hate those prostaglandins. I mean, they're doing their job, but it's not fun for us when they're doing their job. So you've got menstrual cramps. Maybe they're minor. Maybe you're just kind of curious, like, why do we have to have this? Maybe they cause problems for you. One article that I'll recommend that kind of discusses things in a nice, understandable, but comprehensive manner is from, the American College of Obstetricians and Gynecologists, ACOG, and they have an article called Dysmenorrhea, painful periods. If I remember to put the sticker, I can show you what it looks like. And so I'm going to summarize some information from there. A lot of the stuff that I'm going to be saying for this part is going to be coming from there. So I do not want to plagiarize. I just want to let you know what my source is. All right. So we've already talked about what dysmenorrhea is when you're having the actual cramping. Now, more than half of those who menstruate have some pain for 1 to 2 days each month. All right. So that means there's half that don't have any. For me personally, that it's hard to think of that, but I know for them, they're like, yeah, it's just not a big deal for me. Count yourself lucky if you're one of those people. All right. So 1 to 2 days each month. Now, we will get to the fact that there are some people who have way more than that. But, so it's common to have something, at least one, very common to have at least one of your days kind of ruined, perhaps, or at least not as nice as it would be because of this. All right. So sometimes it's severe, sometimes it's minor. So, all right. So what if it's severe? What if there's a possibility of secondary dysmenorrhea, something where it's not just that you're having a period and your body is reacting to the whole process. Sometimes other conditions are causing the problem or making it worse. And so let's talk about some of the causes of secondary dysmenorrhea. And so a big one is endometriosis. So with endometriosis, this is where uterine tissue is growing in non-uterine places, basically. The tissue, similar to the lining of the uterus, grows in other areas of the body. And it can be very painful. And I know many people with endometriosis, they have the story of going years saying something is wrong, please test me, and having medical professionals say, oh, no, I don't think that's what you have. And then they finally get the invasive testing done. And I think sometimes it sounds like the doctors, medical professionals are hesitant to do the testing because it can be invasive, like, doing surgery to see what's in there. There are reasons that they're hesitant to do it, or they're just assuming, oh, this is probably just, the normal thing that people experience. And then when they find out they actually have had this for years and could have gotten treatment much earlier, it's very frustrating. But so if you do have endometriosis and know you have endometriosis, I anticipate that you have many stories of frustration, and I'm sorry that you have had to go through that. And so, the tissue that's usually growing in the uterus, it can be growing on the ovaries, the fallopian tubes, behind the uterus, on the bladder, all sorts of places where it's going to cause pain. With endometriosis, that additional pain comes about from being on places that aren't meant to stretch and just aren't constructed the same way as the uterus. Now, pain and bleeding from endometriosis, because you do get bleeding from the tissue changing in response to hormones. The pain and the bleeding may happen with the menstrual period, or even happen before or outside of the time where the menstrual period is happening. And so sometimes people will say, I'm having really long periods, or I'm kind of having 2 periods. What's going on here? Those are the sort of things that, you would hope a medical professional would check into. But I have heard stories from friends and people online just saying, yep, they just kept telling me everything was fine, and it wasn't. So be loud, be insistent. Say, please test me. As I'm often telling my students, don't be afraid to be a B word if you're concerned about your health. This often comes up when we talk about maternal mortality. Sometimes you save your life by insisting that they look into something. All right. Comes up a lot. All right. So with endometriosis, so sometimes the signs are very painful, very heavy or irregular, or periods that don't follow, your typical pattern, typical timeline. And then in severe cases, endometriosis can cause damage, scar tissue, adhesions that can actually cause things to stick together. And that is very painful. And sometimes the worst case scenario is when they have to wait until that happens before it's detected that they have the problem at all. So be loud, ask for testing. What else? What else can cause secondary dysmenorrhea? That would be fibroids. My old not friend, fibroids was the thing that took me down and finally got me a hysterectomy. All right. So fibroids are growths. They are non-cancerous growths that form on the outside, on the inside, or in the walls of the uterus. I managed to grow it in all 3 places. And it wasn't fun. I'm not smiling because it was fun. And fibroids located in the wall of the uterus can cause pain. That's an understatement. And small fibroids usually do not cause pain. Okay, folks. As someone who had fibroids for years and knew I had fibroids for years, because I would be getting an ultrasound like for pregnancy or pre-pregnancy or after pregnancy, and the tech would be like, "Oh, I'm having some problems here. Oh, have you had problems with fibroids before?" I'm like, "Nobody's ever told me I have. Why do you keep asking that every single time?" And they wouldn't be able to tell me. And finally, I would pressure the doctor. I'm like, "Can you please tell me why they keep asking about fibroids?" And they're like, "Oh yeah, we usually see some signs of fibroids when we look in there, but fibroids don't cause problems, so it's okay." But I had problems with infertility, I had problems with miscarriage, and fibroids can contribute to both of those things, even though they often don't. It's just like, can we talk about it? Can we, and it wasn't until I was passing out or almost passing out at work, bleeding through multiple menstrual products in the course of an hour, that finally I was like, "Can we please look at this?" And my doctor, and I like my doctor, she's very understanding usually, but she had just been like, "Oh no, fibroids are usually not a reason to be concerned. We're not concerned about fibroids." And so she went inside to do the usual checkup. And she went, "Ooh," and I'm like, "Oh, what?" And she's like, "I can feel a fibroid. I'm pretty sure that's a fibroid." I'm like, "Oh, you mean like I've been saying I might have?" And they did an ultrasound, and I had 3 fibroids, in one and an inside and outside and in the wall. I had 1 the size of an orange and 2 the size of plums. The uterus is very small, though that's big. That's big, and I was bleeding constantly, and so I got a hysterectomy. And I'm pretty sure the only reason they were amenable to me getting a hysterectomy, I was already in my late 40s, perimenopausal, and I already had kids. Yeah, I'm pretty sure if I hadn't already had kids, they'd be like, "Oh, you don't want to do this. You won't be able to have kids." And I probably would have been hesitant because having kids is very important to me. But fibroids. They are not fun, and they can cause problems with this too. Now, there are other things that can be done for fibroids beyond hysterectomy. Now, as with any type of menstrual cramping, pain relievers like ibuprofen might help, and then also birth control. Some people go on birth control not for contraception, but for helping with pain, and for some people, that is helpful. And then also we have these medications called GnRH agonists. That's gonadotropin releasing hormone agonists. They help with that hormone. And then there is a treatment called uterine artery embolization that may help. And I know when I was having problems, I was reading about various things that are available. It's the sort of thing that hopefully, if you can get your doctor to listen to you, that you're having a problem with fibroids, that they can go through your options for what can be done. Hysterectomy is generally considered your last resort option for various reasons. A big reason being that it's pretty, it's severe. You're removing an organ from the body, and it's surgery, requires recovery, and then you can't get pregnant afterwards. And if that's important to you, that will be an issue. Now, another big problem, another big issue that can lead to secondary dysmenorrhea is adenomyosis. All right. So adenomyosis is when tissue that normally lines the uterus begins to grow in the muscle wall of the uterus. And some of the things that are done for fibroids are also done for adenomyosis. And this condition is more common in older women who have had children. All right. And then you have other various conditions that can contribute to uterine pain, cramping pain, any kind of problems with the uterus, fallopian tubes, other reproductive organs. I'm looking at an article that uses the word defect. I don't like the word defect. How about difference? And just various things, medical conditions that can make cramping worse, like Crohn's disease and urinary disorders, because, if things, the digestive system and the urinary tract be, close together and affecting each other. All right, it's starting to rain outside. I don't know if you can hear it or not. If you can hear the noise, I apologize. Live in a rainy area in the rainy time of the year. And so what can you do? If you are having menstrual cramps, whether it be primary or secondary dysmenorrhea, what the heck can you do about it? The big thing that a doctor is going to recommend right away, using pain medication like ibuprofen or NSAIDs. I never quite know how to, but non-steroidal anti-inflammatory drugs. All right, Aleve, Motrin, Advil. All right. Many of us know that that may not cut it, but what else can help? Applying heat. So a heating pad or hot water bottle can be helpful. I mean, it doesn't fix everything, but it often at least gives you that sense of relief. If you're not at work, if you're not at school, if you have the option of lying down with a heating pad, it can be helpful. And I know they make all sorts of fancy products now, like, the stick-on hot patches and things. If you like them, great. A lot of people say, a hot water bottle or heating pad that you can put in the microwave works fine. Whatever works for you, but applying heat does seem to help a lot of people. And I already mentioned that some people will go on birth control, not as contraception, or sometimes it's also contraception, but also helping with pain. And for some people, that can actually make things worse. It depends on the person, depends on the actual specific formulation. Yes, that's the right word. Formulation of, the various mixtures of hormones that are in the birth control that you are prescribed. Something to talk to a doctor about, but that can help some people. And then also vitamins. Okay, there's some evidence, but we need more. But there is some preliminary evidence, at least, that vitamin B1 or magnesium may be helpful. Now, one thing to tell you is with magnesium supplements, be careful. If you use magnesium citrate, that can give you loose stools. So be careful which kind you get. Sometimes it's trial and error to figure out, hey, does this help you at all? But that could help. Now, some other things that are recommended: exercise. Exercise helps with everything. Getting more exercise, unless you injure yourself from the exercise is generally going to help with a lot of things. So get more exercise. That's just advice for life. Sleep. Getting enough sleep. Again, that helps with a lot of things. If you get enough sleep, it's good for a lot of things. It also helps with cramping. Yes, and relaxation, less stress in your life. How do you do that? I don't know how to do that. But if you can make it happen, it helps with it. It does seem to at least be correlated with less cramping. So if you figure out how to get more sleep and relax more, please let me know how to do that. And you should definitely exercise. Exercise is good as long as you don't injure yourself during the exercise. So be careful. Right, I think I'm going to wrap it up. And I hope if you wanted more information about menstrual cramping, that you got more information. And remember, if you have concerns, please talk to a medical professional who has a different degree and training than I do. And I will talk about more stuff in the future related to the uterus and other, health concerns that people often ask me questions about when I teach things. I'm thinking of addressing menopause stuff in the future. But I have to get all that together. But maybe that will be in the future. If there's anything else that you'd really like me to cover, go ahead and let me know in the comments.